Welcome to Three Questions With, a program by the Latino News Network produced in collaboration with CAN TV. LNN is dedicated to best serving Hispanic Latinos with local multimedia news and information websites across the U.S., including Illinois Latino News, a statewide community-focused initiative. Three Questions With is a public affairs program elevating the voices and visibility of matters most important to the Hispanic Latino community by speaking with community and industry thought leaders on the social determinants of health and democracy. I'm Hugo, publisher of LNN and your host. Earlier this year, Governor J.B. Pritzker was heavily criticized for his decision to limit enrollment to two state-funded health insurance programs, some of the only health insurance options for low-income, undocumented people in Illinois. Supporters of the move say the Medicaid-style programs created in 2020, in part to help those most in need due to COVID-19 emergency, are just too expensive that the state cannot afford the programs. Advocates, however, like Esther Corpuz, CEO of Alivio Medical Center, argue it is not just immoral to deny health care to those who need it the most, but also short-sighted and ultimately fiscally unsound. Alivio Medical Center is a bilingual, bicultural organization committed to providing access, quality, cost-effective health care to Hispanic community, the uninsured, and the underinsured. Esther Corpuz is our guest today. Esther, welcome to the program.
Thank you, Hugo. It's my pleasure.
So let's start with the vision of Alivio Medical Center, a multi-site medical center providing well-coordinated, integrated, comprehensive, culturally sensitive, and quality services. Tell us more.
Yeah, so we've been around now for 35 plus years. I think the uniqueness about Alivio in its beginnings is really that it was a grassroots organizing effort. And so while we provide healthcare delivery, we're very involved in the community. We provide primary care, which means we're the medical home to over 40,000 patients in the community. These are patients that are hard to reach communities, folks who have lack of access to health care and medical services. So we don't want to be episodic care, meaning you come in because you have a cold. We want to treat you for your overall well-being, diabetes, making sure that you're living a healthy life. So we have primary care physicians, which includes dental, vision, pediatrics, OB. We have parteras, midwifery program. We have community health workers who are they're our extension to the community, and they work coordinating some of the care. What's unique about our patients is that 95% of them are have either no insurance or limited insurance, and so you have to have that trust with the patients that you're serving in order for them to come in. And so our community health worker program, which has grown with many organizations, but Alivio, from the day it opened its doors, we used to call them compañeras en salud. That was something that our founder Carmen really believed in. It's a model that is accepted in Mexico. And so we are really the medical home to our patients and making sure that not only are they're getting high quality, but as you mentioned, integrated, so that we're talking to each other and making sure that if we refer you to someplace, that you're coming back to us and that we're keeping track of what's going on with your health care. So we also have a very large mental health, behavioral health program that includes social workers, counselors, psychiatrists, nurse practitioners that specialize in psychiatric conditions, and oftentimes not really addressed in our community and with our patients that are Latinos don't really talk about their emotions. It's sort of taboo, and so we're trying to demystify some of the barriers that they face when they're addressing their emotional needs or substance abuse, all of those things, which are also services that are often not covered. So, for example, we charge $5 for a mental health visit if you have no insurance. and that was a change that we made simply because we found that patients weren't coming back as often as they were asked to come back, and that was because it wasn't affordable. And so $5 was where they told us they could afford to come back 2 or 3 times a month for counseling. So really trying to address the needs at the request of our patients.
Yeah, and a lot of what you described is relationship building, building trust, asking questions. What do they need from an economic standpoint, from a total wellness standpoint? But one of the things that you mentioned was mental wellness, which, as you said, in our culture, it's a taboo. It's seldom talked about. But there's a new program that Alivio is introducing that's focused on youth. Tell us about that.
Yeah, so we recently had the absolute pleasure of and wonderful opportunity to hire a board-certified adolescent physician, Dr. Rebecca Fenton. She finished her fellowship training at Lurie Children's Hospital, and so she focuses on adolescents from, well, she's a pediatrician too, so because we even have young children with that, are doing things that are that we're concerned with, but she can see kids up to 25 years old actually. But what she focuses on is emotional wellness. So she treats folks with gender identity issues. Sometimes, we have found a lot of adults that come out later in life but have struggled with it when they were in high school or even younger. And so she has a gender identity clinic. She works with eating disorders. We have some unfortunate where children are hurting themselves by cutting and doing other things. So she specializes in that kind of emotional health for adolescents. And we have 3 school-based health centers, 2 in high schools, Little Village Academy, Benito Juarez, and then we have at Orozco Academy, which is a primary grade school. And she works with those students as well as in the clinic at our Morgan location.
That's great to hear. And I think anytime young people can chip away at some of those barriers that maybe in the household exist, to be able to talk about things that maybe they don't feel comfortable speaking to their parents is so important. Now, Alivio is continuing to expand. There's going to be a new center, Mosaic Square, I believe it's called,
yes.
That, knock on wood, will open in 2 years. Tell us about that.
Yeah, so it's located at 44th and Cicero. It used to be a lot of folks know it as the LeClaire Courts housing location. And about 15, 18 years ago, it was demolished. And that land has been vacant for all these years. And through the leadership and vision of Martin Cabrera, he had this idea of, we got to do something to that corner to make it, an asset in the community. And so one of the things, when we were listening to the community, a big issue that came up was it's a medical desert out there. There are 2 hospitals. One is McNeil Hospital, which is about 5 miles away, and then Christ. But primary care services are almost non-existent. So we will be the primary care center with a 60,000 square foot building that will also include imaging, because what we find too is with our patients, lack of transportation, it's hard to get to a hospital. We'll have a breast center, so we'll have mammography services. We'll have an urgent care center with general radiology services, and a building that will also have primary care, but also connections with academic institutions. Growing our own, having a medical assistant program. We also just recently hired Dr. Kathy Tynes from Northwestern, who will be leading our residency program and bringing residents. And so we very focused on residents that want to work in our community, serve the types of patients that we serve. And so we're super excited about it. We'll also have on the campus, there's Tony Finer Foods, because I think we all learned during the pandemic that there's, social determinants of health that have always existed, but really were heightened during the pandemic. And food insecurity is one. Housing, so there will be housing for about 600 residents. with non-traditional apartments. Some of them will even have 5 bedrooms and 2 bathrooms. I grew up in a one-bedroom apartment with 1 bathroom. I think that's probably the story of a lot of us. And so this is going to be a very special project with a lot of components, not just healthcare, but really addressing a lot of the needs in the community.
Yeah, holistically, from, like you said, food to housing, and not just wellness, physical wellness and mental wellness, as we've talked about. Great. I want to transition now because, like so many people, you wear different hats. You're juggling. You're also leading Healthy Illinois. Now, as previously mentioned in this program, the Pritzker administration limited enrollment to 2 state-funded health insurance programs that were critical in keeping people safe during the COVID emergency. Healthy Illinois campaign, an advocacy group that you lead, condemned the move by stating that, quote, by slashing life-saving health coverage for Illinois immigrants, the governor is turning his back on the communities he claims Illinois welcomes and that he's aligning himself with anti-immigrant Republicans around the country. Tell us more about Healthy Illinois and the work that you're leading in that space. And of course, tell us about what's happening right now since that decision by the governor.
Yeah. So we actually had a rally today at Federal Plaza with over 600 supporters. We have had a great relationship with the Pritzker administration, and we continue to try to work with him to work out. We know that, I think we did a really good job of enrolling a lot of people. We are close to 70,000 Illinoisans. There's 150,000 that are not covered due to their immigrant status. They claim it's a budget issue. We understand that this is an expensive program, but if you look at healthcare in general, and if you invest on the front end, providing preventative care, doing those screenings, prostate screenings, breast cancer screenings, you're going to have overall a healthier community. You're not going to have the cancers later, which are much more costly. Treating patients in the hospital is not the way to treat patients. In an emergency room, using that for primary care is not the solution. So today, the state is no longer accepting individuals who are under who are not seniors. So the senior population, there's a cap of 16,500. We haven't reached that cap yet, but we're pretty close to it. So once that happens, seniors will no longer. They will be capped at that point. So we continue to work with the Pritzker administration to, work out whatever issues so that we can reopen the program. We have a lot of support from a lot of elected officials. I think especially right now with new arrivals coming in, it is definitely a crisis. We at Alivio we're serving patients that are in shelters and living living in police stations with no insurance, no access to health care. Many of them come to us with, diabetes. They don't have any more medication, and now their diabetes is uncontrolled. We had a gentleman the other day that had a bad ulcer. He has to go to the hospital. He's facing maybe a possible amputation. So that's why preventative care is so important and much cheaper than delaying that care. So we will continue to fight and to work with whoever we have to work with to reinstate the program, because we believe in it, and healthcare is a human right. We say that a lot, but it's time for us to put those words into action and meeting the needs of our communities.
You mentioned preventative care is so important, and you use examples of how that might be even more costly than investing in caring for any person after the fact than before is much more costly. And the governor and people who support him say it's too costly. They need more help from the federal government. Based on your experience and the work that you do, what kind of help does Governor Pritzker, Mayor Brandon, need in order to continue to help the communities that need it the most, not just undocumented immigrants, but people who don't have the means for it, what are some thoughts that you think are possible solutions?
Well, I mean, I think federally qualified health centers like Alivio, and there's, across the country, we're very good servants of the money that we receive. So we do get some federal money to serve populations that are hard to reach. So I think reinvesting in an infrastructure that exists already, like federally qualified health centers, is really probably the most efficient, least costly, and has the better results. We have great data that supports what I'm saying. So I think that's one thing. I think that there's opportunities that the state has not taken advantage of. There is federal match for some of the emergency care that we provide if somebody gets admitted. There is federal dollars that match that we have not taken advantage of. So I think we're still leaving some money on the table that we need to look at. We need to get the brightest minds to the table to figure out what else can we do. But I think that there are opportunities out there, and to really look at overall what is the most cost savings, but also going to have the best outcomes for our communities. Because I think we're being very short-sighted in saying this is too costly of a program, but we're not looking at the big picture. I think one of the other factors that happened early on is that we have to remember that a lot of these individuals that enrolled in the program haven't had health care forever. So of course, they were like, okay, I need my mammogram, I need my colonoscopy, I need my prostate check. So we were inundated with a lot of preventative care, which is costly, and we discovered that some of these individuals had pathology and needed to be addressed. So on the front end, it was much more costly, but that will taper off with time, because they now have medical homes, and we will be taking care of them. They won't be putting off that preventative care that they have been for the last 20 or 30 years.
It requires a multi-pronged approach. It certainly needs collaboration and cooperation. You are watching Three Questions with Esther Corpuz, CEO and President of Alivio Medical Center. When we come back, we're going to learn a little bit more about her upbringing and how her family helped influence her lifelong work in healthcare.
I am Dr. Obari Cartman, inviting you to join us for an all-new episode of Brothers Talking, where the brothers and I will discuss Black men and sexuality. The brothers and I will look forward to seeing you on Thursday, October 12th at 7 o'clock p.m. exclusively on CAN TV, cable channel 19, streaming on cantv.org and on the CAN TV Plus app. Experience the power of community television.
You're watching Three Questions with Esther Corpuz, CEO and President of Alivio Medical Center. We've talked to Esther about the work that Alivio does in regards to preventative care. We talked about mental wellness. We've also talked about Healthy Illinois' campaign that is advocating for health equity. Now we're going to talk about you. You grew up in Pilsen. You're the daughter of diligent, hardworking Mexican parents. Tell us about that, and tell us how that inspired you to do the work that you're doing today.
Yeah. So yes, I grew up in Pilsen on the corner of 19th and Wood. My parents owned a business. Many people know it as Speedy's Snack Shop. My maiden name is Gonzalez. My father, Speedy Gonzalez, and he was not fast. That was a joke. He was probably slowest because he was a talker. Unfortunately, one of the reasons I really was drawn to healthcare is that my dad died very young of heart disease. He had a heart attack at 42. And, I had to grow up really fast. My mother raised my sister and I together alone. And, I was always very interested in healthcare from, the passing of my dad. But my dad was, because my parents were very, very different. My mother was very quiet and just a very hard worker. My dad was the talker, and he would welcome, new arrivals from Mexico into our home and give them jobs. And so many of them, we know none of them had health care. If they cut themselves at the restaurant, it was a huge burden for them and for my family. But my mother, after my father passed, what I learned about my mom was that it was a hangout for kids after school. They did their homework there. She had video games in the back room. There's a lot of people that are leaders in Chicago that my mother took care of them and taught them right from wrong. Sometimes they would come in with a $20 bill, and my mother go, where did you get that $20? You better not have stole it from your mother. So she had some life lessons for them, and but always taught us that we need to give back to the community. Both my parents did. And so my sister still lives in Pilsen. I work now in Pilsen. That's part of what drew me to Alivio and to Carmen, who's the founder of Alivio and certainly a mentor in where I'm at today. Just knowing that growing up in Pilsen, I absolutely wanted to go back to my roots and serve the population that I grew up with. And there's, it's really interesting. There's so many leaders from Pilsen and Little Village when you think about it, that we're all like, wow, But I think it was because our parents really struggled and really helped shape who we are today, and the importance of never forgetting where you came from and always giving back and trying to make the community a better place. And so definitely both of my parents played a large role, as well as other people like Carmen and other board members that I work with and people that I've known over the years.
Yeah, we're fortunate to have people in our family and others that put us on their figurative shoulders to be able to reach higher and see further than we could on our own 2 feet. As someone in the work that you do, young people, normally when we talked about mass media and unfortunately our community being absent, especially when we talk about leadership roles. So when a young person, and not such a young person, here's what you're leading with Alivio, what you're leading with Healthy Illinois, what advice would you provide them if they're interested in the healthcare industry, and not just as MDs and RNs, but just again contributing? What are some words of advice?
Volunteer and learn. We're lucky that we do have a lot of volunteers, and I often get students that come and spend time with us, and also I think by doing that, we also I try to respond to people that call me and are looking to shadow. And you're right, it's not just nurses and doctors. It's healthcare. You have people like myself in administrative roles, grant writers, promotoras. It's a vast array of different subjects. So get involved, volunteer, don't be shy, speak up, be a disruptor, speak your mind, and I think that's really important.
Get involved, be a disruptor. Esther, thank you so much for your time.
My pleasure. Thank you, Hugo, for having us.
You've been watching 3 Questions with Esther Corpuz, CEO and President of Alivio Medical Center. When we come back, La Ultima Palabra on mental wellness.
Hi, I'm Darius Hillman. Join me for an all-new edition of In the Arena, Tuesday, October 17th at 7 p.m., followed by the series premiere of
Every Day is a Yay! Hosted by me, Jewel Faguni. Join Darius and me Tuesday, October 17th, starting at 7 p.m. on CanTV Cable Channel 19, or stream live on cantv.org or on the CanTV Plus app.
Experience the power of community television. How about that?
Yes!
And now, La Ultima Palabra, the last word on mental wellness. Like so many people, I struggle with managing my mental health. Man, I can't tell you how long it's taken me to admit I'm not well. I'm a Latino, son of Peruvian immigrants, and in our culture, we just shake things off. Part of the challenge is that Latino cultures fear being labeled loco if they express mental anxiety or concerns and do not want to be viewed as weak or mentally unfit. Growing up, we just didn't talk about fear, anxiety, depression in my family. We didn't talk about it, but we certainly witnessed and experienced it. Like many immigrants, my parents juggled several jobs to make ends meet. I almost never saw my father during the week. He was already at his first job when I got up to go to school in the morning and not back from his second job when I went to sleep at night. My mother also had 2-3 jobs. She wasn't clean when she wasn't cleaning homes and offices, she was sewing clothes at a sweatshop. Many of my summer afternoons were spent having lunch with her outside the factory where she worked. We're talking about two people who left their country at the age of 21 and 18, a time when most people, myself included, are thinking about a higher education and having fun. They picked up and went to a country where they did not know the language, culture, etc., not because they wanted to, but because they had to. So while they never spoke about it, neither did I, how could I, all the weight they carried absolutely affected their relationship and ours. Not getting help from me meant not understanding what was wrong, and it undoubtedly seeped into my own personal relationships as an adult, including the one with my wife and children. Evidence suggests that approximately 10 million people in the U.S. in the Latino community reports having a mental health condition. More than half of Hispanic young adults ages 18 to 25 with serious mental illness may not receive treatment. Research also indicates that serious mental health conditions among the Latino population are increasing. Latinos not seeking help with mental health issues stem from various different factors such as economic barriers, language barriers, religion, and most importantly, the mental health stigma. I am still struggling with getting help. Please seek out the help you need, that we need, because without treatment, mental health conditions often worsen. And that does it for this edition of 3 Questions With, a collaboration with Illinois Latino News and CAN TV. I invite you to look us up on our websites and chat with us via social media. Tell us what you think about the topics we talked about today, and please send me suggestions about what you think we should talk about in the future. Because at the Latino News Network, you are more than just our audience. You are our contributors. I'm Hugo. Thank you all for watching.